Who is a good candidate for nose filler? A good candidate for nose filler is someone that has small changes they want to make to their nose, and they're okay with these not being permanent changes. As we know, filler only lasts a certain amount of time based on which filler that you choose. In general, the ones that we use in the nose last about a year. The changes that you can make with filler are more subtle, and they're not as versatile as what you can do with surgery. And so basically, you're just kind of hiding things that are around the nose. The perfect person for nose filler is someone that has a bump that they want to hide and a tip that they want to lift up. This, you can put filler above and below the bump so it's nice and straight, and then you can use filler to lift the tip and define it just a little bit. If you have little depressions, filler is great to fill those areas in. You know, if it's off just a little bit, you can fill it in. It does not work great to narrow the nose or to make it less projected. So you can just add to the nose and kind of camouflage, but you can't make it smaller because that's just not the way that filler works. Also, like I said, this is a temporary change, and so sometimes people will do filler first and see if they like the way that that looks, and then if they decide, yes, I like the way that looks and I want to do this more permanently, then you can move on to rhinoplasty, either once the filler is already dissolved or have the filler dissolved and then move on to surgery. How much is a non-surgical nose job? This varies from place to place in the way that this is priced. So you will have a charge for the filler itself that can run from around $400 up to even $1,200. And then usually there is a charge for the non-surgical nose job because this is a more technically difficult area to inject, and this can run from $500 up to $1,000 or more for that charge itself. The nose is a place that you want to have someone that injects it and knows the anatomy inside and out. There is a lot of vasculature here, and the primary concern is you want to make sure that you do not inject into a vessel because you can have tissue necrosis, which is a really scary thing, and you don't want to have that. Also, very thin skin, and sometimes you can see the filler if it's not done well. So this does cost a little bit more than just getting filler anywhere else because it is a little bit more complicated and a little bit more technical. Have questions? Call or email anytime. I help patients like you every day. I'd love to talk and understand what you're hoping to achieve. Thanks for watching.